So you've made all the lifestyle changes, you're healthier than ever, and still not producing enough swimmers. Let's talk about the different medical therapies and medical conditions that we may need to address next. We'll start with fertility medications, beginning with the most effective combination, a medication called hCG and recombinant FSH. These two medications replicate the hormones produced by the pituitary gland to stimulate testosterone production and sperm production in the testicles. hCG will stimulate the Leydig cells in the testicles to produce more testosterone. Recombinant FSH will stimulate the Sertoli cells in the testicle to produce more sperm. These medications work synergistically and can significantly improve sperm production for some patients. The biggest downside to this combo is the cost. It can often cost thousands of dollars per month, and they're rarely ever covered by insurance. But if you want to give yourself the best shot in a short period of time, this would be your best bet. The next most effective by a pretty wide margin would be a combination of hCG plus Clomid or Enclomiphene. Again, hCG stimulates the Leydig cells to produce more testosterone, which can indirectly increase sperm production. The Clomid can stimulate the pituitary gland to also send more FSH to the testicles. This isn't as effective as using hCG plus FSH, but it's significantly less expensive. Third on the list is hCG monotherapy. While using hCG alone has worked well for a lot of people, it's only providing one of the two necessary signals to the testicles. Again, hCG mimics LH, which stimulates the Leydig cells to produce more testosterone and indirectly increase sperm production. But it can sometimes actually suppress the production of FSH from the pituitary gland, in which case you're not getting optimal stimulation of the testicles for sperm production. hCG monotherapy at the doses required for fertility is still pretty expensive, but it's significantly less expensive than the combination of hCG and FSH. Last on the list is Clomid or Enclomiphene. Clomid works by stimulating the hypothalamus to send more signal to the pituitary gland, so the pituitary gland will produce more LH and FSH, stimulating the testicles to produce more sperm. If you're already producing a decent amount of sperm, but just not quite enough, Clomid may do the trick, and considering the low cost, it might be worth a try. But if you have a significantly low sperm count, or you're in a big time crunch, you may be better off skipping Clomid and opting for one of the more effective options on the list. Lastly, we'll talk about a very common condition that we often see associated with infertility called varicoceles. Varicoceles are the enlargement of veins that attach to the testicle. As I mentioned in my previous video, the testicles are very sensitive to temperature. When you have a varicocele, you have a bundle of enlarged veins full of hot blood sitting on top of the testicle. The heat produced from the varicocele can significantly diminish testosterone production, sperm quality, and sperm count. Varicoceles are one of several reasons why it's important to get a thorough physical exam when being assessed for infertility. Varicoceles can be detected on a physical exam and then diagnosed via ultrasound. If necessary, varicoceles can be repaired with a relatively simple surgery where the enlarged veins are blocked off so blood can't pool in the scrotum. About 60 to 70% of men who get varicoceles repaired will see an improvement in their sperm production. Improvements in sperm production may be seen in as little as 3 months, but the full benefit may not be realized until 12 months after surgery. To summarize, if lifestyle hasn't been enough to improve your sperm production, the plan of attack is as follows. The most effective but most expensive would be hCG plus FSH. Next would be hCG plus Clomid. Then hCG monotherapy, and last would be Clomid or Enclomiphene. In addition to the medications, you should also be assessed for varicoceles and consider a repair if necessary. If you're struggling with infertility, make sure you're working with a provider that specializes in male reproductive health. You should get a full diagnostic workup and a treatment plan that's tailored to your specific situation. There are plenty of options and there's still hope. Remember, what's good for the man is good for the sperm. Make sure you like and share this video with anyone you know that's trying to become a dad. And be sure to subscribe to Strong and Hard for more evidence-based content on fitness and men's health. As always, get strong, stay hard.